Welcome to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordan Comstock and Mr. Ben Tuine.
What's up, everybody, and welcome to another exciting episode of the Navigating Dental Insurance Podcast. I am your co-host today, Jordan Comstock. With me, as usual, Mr. Benjamin Tuine. What is up, dog? How you doing?
Pretty good, Jordan. Feeling good today. Getting over that crazy virus. Utah's an interesting place. I love living in Utah, but one of the downfalls of living in Utah is the respiratory illnesses that circulate in the wintertime.
Yeah, it sucks.
But I guess that's the price of doing business here, right?
That's the price.
The winter paradise.
Yeah, today is super cold too. I don't like it. I wish I was somewhere warm. But I always wish I'm somewhere warm, Ben. So I don't know.
That's why I keep my photo background of my homeland right there in Hawaii.
Yeah, I love it.
An island boy's got a dream.
Awesome, man. Well, pumped for the show today. We got a guest on today's show. His name is Dr. Russ Morrow. And Ben, tell me how you know Russ, and then we'll introduce Russ here and move forward with the show.
Yeah, so Haley reached out to me, kind of going through Russ's background, and actually shared a story about this tongue tie, which we'll talk about here on the podcast and get Russ's opinion on this and how his daughter kind of experienced that. And I looked into Russ's background and I thought, he's had a number of very important key roles in dentistry from a leadership perspective, from a regulatory perspective, being on the board of dental examiners, that I thought this is a perfect person to ask questions about some of the regulatory issues behind insurance, but also to kind of go into his personal story behind this whole tongue tie issue that his daughter experienced. And so, of course, we got him scheduled, and I'm very excited to speak with him. Dr. Russ, thanks for joining us today.
Yeah,
Thank you for having me. Yeah, and you guys are not experiencing the warmth of Arizona that I'm in, so I enjoy that dramatically. But I did live in Utah for most of my life, and that inversion stuff is not a joke. I remember praying for snow just to get rid of the smog that was capped in there.
Yeah, it gets pretty bad right now. Right now there's a storm. It seems like passed, so we don't have much smog. But yeah, it gets pretty nasty here in terms of breathing.
Hard to breathe if you have asthma or lung issues, which my dad experienced every time he came to Utah.
Yeah.
He usually didn't come in the wintertime because of the inversion. But if you're a skier, gosh, you can't avoid Utah. Oh yeah, it's on the map worldwide.
Well, I'm considered a snow snob, so I don't ski anywhere else. So
nice.
I skied a few places just because of the company, but I will never go anywhere else other than Utah to spend my money.
Where's your favorite up here, Russ?
Oh, I'm an Alta snowbird guy, and
nice.
Alta has the best snow in the world, and the snowbird's fantastic as well. But mainly it was Alta for me, unless I had snowboard buddies that wanted to go snowboarding, then we go on snowbird.
It's crazy. It seems like the locals here, Alta is like the number one for people up here in Utah. And then Powder Mountain, a lot less busy for people that don't like crowds, up there in Ogden. But
I've never skied Powder Mountain, but I've heard it's amazing.
I hear it. Yeah, I've been up there a couple times, and it's really not busy compared to like Park City, Solitude, Alta. Sundance even is getting very busy. But yeah, Utah, what do they call it on the license plates here? Greatest snow on earth, right?
Greatest snow on earth.
Greatest snow on earth. That's good. It's too bad I hate the snow, man.
We're gonna have to convert you, Jordan.
Yeah, I guess. Well, awesome. Let's begin the interview. Russ, tell our listeners a little bit about yourself and how you got into dentistry.
Awesome. So how I got into dentistry, I did a 2-year church service mission in Nebraska for all the Utah people out there. And while I was there, I was working on campus at Creighton, and I worked with a lot of dental students at Creighton. And they all have hot wives. And I'm like, you know what? I want a hot wife. So that's where it jumped off of when I was 18, 19, 20 years old, I think, when I was there. And came back, went to the University of Utah for undergrad. And then I went out to NYU dental school And yes, I overpaid. And I was it was a good place to live, but I don't know if I could ever go back and live in New York for any period of time. And as a baby dentist, my first job was working in an office in Washington D.C. area, and my boss went from 7 offices to 28 in a matter of 4 years.
Wow!
And I went to work one day, and he turned up and said, "Hey, by the way, I just sold to Heartland Dental for $90 million." And I said, "What does this mean for me?" He says, "Nothing, just keep drilling." And so that's what I did. I kept drilling for my entire career. I didn't even have a choice on where I was going to work, because Heartland just picked us up. And but the beautiful thing was Heartland had offices all over the world. We now have 2,600 doctors, 2,800 doctors, 1,600 offices, 1,800 offices, something like that.
Mm-hmm.
And I said, "Can you get me to Arizona?" They said, "We'd love to have you go to Arizona." They didn't have any senior leadership out here. So they moved me out here, and I started doing, I was basically the regional doctor mentor of operations was my title. Everything at Heartland's has an acronym.
Sure.
Basically, I just wanted my new doctors not to suck. And so that's what I tried to train, was make sure my doctors were doing good dentistry the right way, doing the right thing for the right reason.
Mm-hmm.
And
Cool.
And so that led me to a whole bunch of other opportunities. For instance, right now I'm on my 6th year of serving on the Arizona State Dental Board.
Wow.
So helping new doctors get great has always been my passion. But I think part of that is understanding the regulations and the regulatory aspects of things. After being on the dental board, I realized the importance of doing documentation and notes and billing properly and all the stuff that goes along with that to keep me from being on the other side of the dental board.
Yeah.
Sure.
And so it made me a better dentist, but at the same time, it's been a service of love. There's no, I think everyone says, "Yeah, it'd be great. I'd love to be on the dental board." It is tough, dealing with dentists, but also protecting dentists at the same time. And there's a balance between that, and being a protector of the public, but the dentists are also the public.
Yeah,
So
sure.
So you have to weigh those things pretty carefully to make sure. And then I started teaching some courses. Some of those were in laser stuff, and that led me down the road to what I'm doing now. I was made the chief dental officer for BioLase back in November.
Congrats on that.
Congrats.
It is so strange to go from full-time patient care, 40 hours a week, running like crazy with my hair on fire, hanging out at home doing podcasts.
Hey, that's what we like to do. So welcome to the club,
it's
man.
so nice. It's liberating. I still am practicing 1 day a week. So I still go in on Mondays, still actively practicing and doing those things. But it really gave me the other perspective of helping dentists grow to find the things that they want to do, be the type of dentist they want to be, and do the type of dentistry they want to do.
Yeah.
And so that's kind of been my passion is to help these dentists, whether they be brand new out of the gate or now if they are brand new laser users. That's kind of where I fall in.
That's awesome.
Cool.
Did you know Tim Quirt?
Oh, I know Tim real well.
Yeah. His story is kind of similar, right? Where he had 9 or 10 practices, and of course he comes from a family of dentists. That's one of the interesting misconceptions that a lot of people don't understand about Heartland is that these are day-to-day doctors that are really committed to their patients, a very, very strong commitment towards quality of care.
Sure.
And getting to know a lot of the Heartland dentists in the model, of course, going way back to Rick Workman, Dr. Workman, when he started the whole thing. He actually showed up, what's that current conference called? The DEO, went back when it was run by Mark Cooper. So I was on one of the panelists on that, and there was no announcement that Rick Workman was going to show up to the meeting. So we're up at this, at the Westin up in Seattle, room full of 300 doctors, and then Mark stands up and says, "I'm gonna introduce our keynote," and I told everybody I'm not going to tell you who the keynote is until he gets here. I'd like to introduce you to Dr. Rick Workman. He comes walking in, and this is a conference for doctors getting into building their own mini DSOs, right?
Sure.
There's all kinds of misconceptions from the community about Heartland, including Rick Workman and his work and things that he did. And he went up there, and I thought he was a rock star in how he handled it, because it was total shock that people didn't expect him to be there. I thought he gave a phenomenal speech that was kind of tied into, quality cares first, and then building a business and making money. Yeah, that's sort of the side benefit of, expanding
Quality.
Learning how to play the game from a business perspective, but it should never come at the sacrifice of quality. And I resonated with that, that
Sure.
message. I thought that was pretty cool.
Well, it's nice to have a billionaire in your Rolodex.
Yeah.
Right.
And to his credit, I remember the first time I golfed with him down in Florida. I was in Florida with another buddy and said, hey, let's call Rick and see if he wants to golf, because he's a really good golfer. And so he's like, yeah, sure, let's go. And I said, well, where would you like to go? This is your area. And he goes, we're going to my club, Islesworth. Now, if you're a golfer, Islesworth is like golf mecca.
Heaven.
I remember I hit into Grant Hill, who was in front of us, and I'm like, just nearly hit an NBA legend,
Yeah.
But my buddy who I was golfing with, I tell him I'm a little nervous to play with Rick, and he goes, honestly, Russ, you have to remember something about Rick, is he's just a farm boy from the middle of Illinois.
Yeah.
And he still treats dentistry that way, still treats doctors that way, that he's just a farm boy who works his tail off, makes some really great decisions that are smart. And that's his secret.
Cool.
So he's totally down to earth, pretty easy conversationalist. You don't, for a minute, you forget you're talking to a billionaire because he's just so down to earth. But no, that's pretty cool. That's cool background. Thank you for sharing that, Russ. I'm kind of interested in kind of diving into what you emailed me about originally, was this whole issue behind tongue tie.
Sure.
And that's the first time I've ever heard about it. But as I kind of read your story, I'm thinking, my son has this issue. He probably needs to get treated for it. Do you mind sharing with our listeners this whole, what tongue tie is, and all the fun stuff behind the symptoms, and maybe your daughter's story, if you're comfortable sharing that?
So how old's your son?
12.
12.
So some background, he was a preemie. When he was about 2 years old, they had to snip the bottom of his tongue. I don't know what the tissue's called there, to allow his tongue to move a little bit more.
Oh, the frenum. Yeah.
But yeah, he can't stick his tongue out for more than maybe an inch or so.
So when they snipped it, did it bleed everywhere?
No, it didn't.
Oh, really?
No.
So they may not have gotten deep enough.
They probably didn't, because he probably still needs to go in to get another procedure. But when they did that, it helped a little bit. But right now, I could tell, based upon what I'm learning about this whole issue behind tongue tie, is that he has that. He needs to get that treated.
Interesting.
So here's the interesting thing about tongue ties, is tongue ties go all the way back to infancy. And we're talking with a bunch of guys here on a thing, and we don't understand the whole importance of breastfeeding and all the other stuff, except, if we have a kid that doesn't breastfeed well, then we know we're staying up really late, calming a baby that's crying all night long. As guys, that's kind of what we're doing. We don't understand the intricacies that go associated with between mothers and children. Oftentimes these issues of tongue ties will make it so that these children can't latch properly, and then it really affects how they're receiving their nutrients and stuff like that. Sometimes it fills their bellies with a lot of air because they're really struggling latching on, because the tongue uses these forces to be able to create a suction. And so all the way back down to infancy, and what happens is the tongue is basically tied literally to the bottom of the floor of the mouth, and that tongue can't touch the top palate in their mouth, so they can't create that suction. So to release that is the easiest way to do that. Now, oftentimes these pediatricians, ENTs will take a set of scissors, just like your kid Ben. They can cut it bleeds all over the place. Now, there is a lot of stuff in there that you really don't want to hit when you're taking a set of scissors.
Right.
And especially as an infant, they're not numbing them. And can you imagine having scissors put in your mouth, cut it, and not numbing them?
It sounds horrible.
It was
awful.
A traumatic experience. I remember that experience, because once they cut that, he couldn't stop crying even after we left. He was in so much pain afterwards.
Sure.
And anyway, go ahead.
No, you're 100% right. And then it swells up.
Mm-hmm.
Now, what the laser does is it basically goes through and removes it with very little pain, nearly as quick as, say, a set of scissors. Set of scissors, I mean, that's quick. It's snip and you're done.
Yeah.
But with the laser, you can use a topical anesthetic if they're a little older than an infant. If they're an infant, you don't want to use anything at that point. But you go through, there's not a lot of tissue if they're young, and it cuts very, very quickly. And then you give them a room to take them out and have them nurse. And at that point, that's life-changing for some of these babies and moms. And that's the premise behind these. Now, the byproduct is if they can't swallow very well or they can't stick their tongue out, there's a lot of issues with not being able to stick your tongue out. I mean, it sounds funny to say it like that, but there's sometimes speech issues that they can't swallow properly as they get older.
Interesting.
And think about not being able to eat an ice cream cone properly, right?
Yeah.
But you wouldn't picture that. And I've been a laser dentist every day of my career. So every day of my career for the past 18 years, I've had a laser of some kind in my practice. And so I've always looked for this kind of stuff. And when it came down to it, my daughter, she was born in New York. In fact, her middle name is Manhattan. So it's Reagan Manhattan Morrow.
That's cool. That's cool.
There's a big story behind the name as well. I was losing the argument on what her name was going to be. Her mom wanted to name her Pepper, and I'm like, oh my gosh, I can't name this dog. Small dogs are named Pepper. I can't name my kid Pepper.
Yeah, that's funny.
And finally, in the end, I said, listen, we'll name her Pepper, but I have full carte blanche to be able to name the next kid whatever I want. She's like, what would you name it? And I said, it would be Espen. She's like, Espen, I like how that sounds. How would you spell it? I'm like, ESPN. At that point, her mom goes, how do we name her Reagan? Done. Great. Reagan is better than Pepper. So that's the history behind Reagan's name. Well, as Reagan started to learn to speak, because she was an inconvenient child. She came finals week of the second year in the first semester. It was a tough semester. Mm-hmm. And so she literally came finals week. And so she was one of those kids that had trouble eating and air getting into her stomach. And I'm still in dental school at this point, so I know nothing about any of this other stuff. And she continued to grow, and then she started to speak. And I was probably a senior in dental school, and she started to speak, and she developed a New York accent. Mm-hmm. And she's like, Dad, I want to look in the mirror. And I'm like, oh, no, we're from Utah. We say our R's. And we tried so hard to get rid of this accent. But, and then we kind of figured, okay, well, it's kind of cute. We went through our life. We lived in Washington, D.C. for a bit. And then we moved out to Arizona. It's not nearly as cute in Arizona as it is in Washington, D.C. And then when she gets to the point of being about 11, 12 years old, she starts getting made fun of at school because she can't even say her name. Reagan Morrow turned out to be Reagan Morrow. Oh, sure. And what happened is she's also my cavity queen. She's had tons of cavities. Cavity queen. The fact that if she hears that I'm talking about this, she'd be like, Dad, really? You're gonna breach HIPAA?
You're gonna breach HIPAA?
Right. Now she's 18 now, so she probably could.
Yeah.
But we did Invisalign on her, and as we started putting the attachments on, I said, okay, Reagan, go ahead and lift your tongue. And I realized that she couldn't stick her tongue out or put it to the top of her mouth. And I'm like, oh my goodness, this is the reason why. I mean, there were tears that she couldn't speak her R's properly. And at that point, the dad in me just died inside. Like, I am such a terrible dad that I didn't even check my kid for this. And I'm checking everyone else's kid for this.
Sure.
At that same visit, of course, dentist kids are always the last ones to get worked on too. I said, I got you in the chair. We're going to go ahead and put the Invisalign on. We're going to release the tongue. And she goes, what do you mean release the tongue? And I'm like, I'm going to take a laser. And she's like, no, you're not going to do that. I said, yes, we are. And as they get older, I use a little bit of anesthetic for this, about 1/8 of a carpio, which is not a lot. and I put it right next to the skin underneath the tongue called the frenum. Without a problem. I go through, takes about 3-4 minutes to release that. She went from not being able to stick her tongue out at all to almost touching her nose with her tongue. And immediately I said, "Can you say your name for me?" And she had distinct R's. Now she has some muscle memory still.
Sure.
But it's taken time for her to really understand where that position of her tongue should be. But as soon as I did that, I never heard of her crying again or feeling frustrated because she was getting teased, you know? And so you don't understand the psychological benefit for a teenage girl to be able to say her name properly.
Yeah, sure.
And so that was one of the things I'm like, I need to make sure I'm seeing this in all of my kids. And even I do a lot of frenectomy or lingual tongue ties on adults as well. One of the things is if it's attached to next to the gums on the bottom, on the inside, you can get some recession. So there's some areas dealing with the lingual tongue ties. Now we have 7 frenums in our mouth. There are 3 on top, 3 on bottom, and 1 on the tongue. It's not just the tongue that we worry about. We worry about the other ones as well. And so those other ones, super easy to deal with as well. And they all have different reasons why you would get rid of them. Whether they be from recession and the muscles pulling the tissue away down can cause recession, or if you're closing a space with orthodontics and they have a gap between their front 2 teeth called the diastema, oftentimes the tissue gets stuck in there. So you got to get rid of that tissue. And to be able to do this with a blade or with scissors is just, it's archaic. It's just awful. You got to suture a tongue up and they bleed everywhere.
Yeah,
but with a laser, no bleeding, quick, easy, done, very little post-operative pain.
Wow.
How common is this issue, the tongue tie issue in the United States?
It's a big deal. And I'm trying to figure a nicer way to say that. It happens all the time.
Sure.
A friend of mine, they had a newborn baby that they called over, and I think I was the first one to see them outside of their family. And they're like, "Hey, can you take a look at her tongue?" And lo and behold, she was tongue-tied, and that was like 3 months ago that I went over to their house, checked the baby out, pulled the tongue up, and we released that tongue as well. And then she was able to feed better. So it happens. I don't know if there's a percentage I can give you, but it happens more than you think it is.
Yeah.
This amazing thing about science is, as we kind of further and develop new things, start to realize, like for my son, I thought that his condition was normal, but I suspected at some points like this, he's not, like what you mentioned, he can't enjoy an ice cream. He has to eat the ice cream. He can't lick it, right?
Sure.
It's the regular things that you would think that
day-to-day regular things.
From speech to, from like so many different things, right?
I was on a podcast with his name is Ben Curtis, and Dr. Curtis is a pediatric dentist, and he focuses on this stuff. First off, amazing clinician. He's doing a tongue ties and tequila event here in Arizona. It's coming up in April.
Cool.
We do have some availability. So if there's pediatric dentists out there that want to come down, it's less exciting for the Utah Mormons to think about tongue ties and tequila.
Depends on the Mormon, I guess.
Right, that's true. That's true.
Or where you serve it. Serve it in a closet, and you'll get some to come in.
But he had talked about in his webinar the other day. He goes, and I tell the moms that if we don't take care of this, it's going to limit his ability to kiss when he gets in high school. And I'm like, pediatric dentist telling the moms, and mom's like, "Oh, we got to take care of that." So, and you're thinking about these infants going, they're thinking that, and moms are thinking about, and then I think the best part of that quote was he goes, "His dad has the same problem."
That's funny. I realize my comment might have upset some people. Like, what do you mean serve it in the closet? I apologize. I'm not about to put out a statement. I live in Utah. I don't know how the society works here, but it's interesting that what you did for your daughter sounds like very much changed her life, right?
Oh yeah, but it changed her life, and it also changed how I started looking at things more, and ensuring that I wasn't going to miss something. And it was my own kid that I missed, so. It's not terrible. Like we fixed that problem, but at the same time, I worried about if there were other kids that I could be doing better and focusing on, asking the parents if they have issues with their speech or if they have issues with their eating ability.
Yeah.
Because we don't think about that. As dentists, we oftentimes look at teeth and we're like, I focus on teeth. I focus on the cavity on number 19 that I got to drill and put a filling in there. But we don't talk about the speech often,
I think this is really potentially revolutionary because it's kind of all tied in. I mean, you have material, I mean, the lasers that, of course, SmileLase provides, right?
Sure.
And I'm so fascinated when I talk to doctors that use lasers because there's so many different uses for a laser, right? From discoloration of gum lines and things of that nature to surgery to a number of different things. Thinking about how this is used with tongue tie makes perfect sense because you're dealing with soft tissue, right? Which is what lasers are used for.
Well, and being the nature of your podcast, this is something that I routinely get billed. I get insurance to pay for. Oftentimes I pay at 80% of this. There's certain documentation stuff you have to worry about, like taking before and after pictures, coming up with a diagnosis, putting down the reason for those things, showing those. And then oftentimes, more often than not, they end up paying for it.
So this is even for the tongue tie procedure?
Absolutely, because it's not a laser. There's no laser. There is one laser code, but it's not this one. There are very few laser codes out there, so it's just the same as any procedure you do with a blade. And so you don't say, okay, I've gone ahead and did a frenectomy with a laser. It's I did a frenectomy. The frenectomy is a billable procedure.
Yes,
sure.
I see. Yeah. So you're basically taking existing codes and
utilizing them.
Yeah, you're taking the closest code to what you're doing.
Well, and think about it like this. You don't say when you're doing a frenectomy, I did a frenectomy with a scalpel or with scissors.
Yeah, you don't explain the process.
It's an assumption, right? That you're using
the laser's a tool, and that's all it is. It's a different tool for you to be able to get to your end result of that procedure. Yeah. So that's how I handle a lot of questions about, do we want laser codes? No, I personally don't want laser codes. I want to be able to use the laser as a tool for those procedures. I mean, I use the laser for fillings all the time, but I don't say it's a laser filling. I do filling with a laser. Or a gingivectomy, what they used to do is use blades and electrosurges and stuff like that. We did a gingivectomy. And gingivectomy with the laser is the best tool to be able to do a gingivectomy with.
Can you use, well, I guess it probably wouldn't be the best use of it, or maybe not, just like for a basic prophy?
So prophies are a little different. Prophies are non-invasive to use the rubber, the rubber polishers and stuff like that. But what you could do is assist in your periodontal therapies. So you could do osseous surgery, periodontal surgery, use your laser for that. Now, there's a big key when you're doing osseous surgery that you use it to make a flap, pull it back, and then in the note, you need to put down that you observed and modified bone. And so that's how you can bill out osseous surgery using a laser as the option to be able to do that. Now, we have an I+ laser, which is hard and soft tissue and also enamel. So you can modify bone with your laser as well. And so that's how you can utilize the existing codes to be able to integrate the laser into your procedures.
Gotcha.
I don't know if this helps or not, but when I was a young dentist, I wasn't doing crown lengthenings. Okay, they scared me. I didn't really know. We weren't really trained on it. And then when you talk about lots of flapping and bleeding and all these other things to go along with crown lengthenings, as soon as I got a laser in my hand that eliminated the bleeding, I could do the same procedure to get the same outcome, if not better. And it added a procedure to my tool belt. And I was able to start doing crown lengthenings. And then I moved up into the anterior region and started removing gum and bone in order to maintain that width between what they call the biologic width, where the bone and the tissue meet, the edge of the tissue, to keep it healthy. I would never have flapped an entire upper arch back, ground down bone, sutured. And there's a lot of bleeding, a lot of pain, and predictability is decreased if you're doing surgery like that. Whereas if I use a laser, where I use my laser is where the tissue stops.
Yeah.
Gotcha.
So that's
cool.
I don't know if that matters for your podcast in terms of the insurance benefit and so forth.
Yeah. And I have some other questions regarding that, but I don't want to hog all the time here. But I do have a question. Yeah, go ahead, Jordan.
Real quick, one of my questions earlier was like, hey, how many people, have this in the United States? Because I'm a marketer. I like to know the total addressable market, right?
Sure.
While we were talking, I researched that there's quite a bit. It's 25% of babies and children deal with the tongue tie issue you mentioned, which is really fascinating because that's a large amount of market. That's a large amount of people. 25% of babies and children are dealing with this year over year, right? As new babies are being born, they're 25%. That's a large number of people every year. So that's a really interesting procedure to offer to those children and parents that want to help their children, right?
Well, adults that have never.
And adults probably that have never gotten it. Yeah.
Sure. Well, and to go along with that, if I was a dentist in an area, the first thing I would do is look at some of my people who I'm close with. If I have a pediatrician
Mm-hmm.
or an ENT or a lactation specialist, I would definitely go give my cards to those people.
Totally.
I have a laser. In fact, our laser is the laser of choice for the American Pediatric Association for dealing with the frenectomies. But if you develop a group of people who know you have this laser, this procedure you do,
they can help with that. Yeah.
A huge deal. I know a dentist down in Australia that her entire practice deals just with us, and she charges about $2,000 per frenectomy, and people are lining up at her door, giving her money to release these tongues on these babies.
Wow.
Yeah, that's really interesting. In the United States, that's a large percentage of people that need that procedure done. That's pretty interesting. So BioLase, let's talk about the laser a little bit more. I'm interested.
Sure. So anything specific you want to talk about? I mean, because that's like saying, hey, I want to talk about scalpels.
Yeah, like where do you recommend you start? Like if you're looking into this for the first time as a dentist, what's the Laser 101 conversation?
Laser 101, I love it. All right.
Yeah, that's cool. I like that.
So here's how I started, is what I ended up doing when I was, like I said, I always had a diode laser. A diode laser is a certain wavelength, and I don't want to get too into physics, but basically it's something that's used for soft tissue. And that's where I started my career with, is diodes they're readily available, they're relatively inexpensive, and they do a lot of great things with soft tissue. And so it helped me in the cosmetics and so forth. And I became a great diode user. And I actually started teaching a diode class with Heartland. And that then Heartland said, hey, we'd like to have you do a trial with BioLase to see if we can integrate a hard and soft tissue laser to your practice. At that point, I said, sure, they'll throw it in my practice. I'll try it. And from day one, it was a game changer, because I was already a laser user, but now I was doing it more quickly, greater outcomes, doing additional bone procedures that I was missing before, and then just adding tool after tool after tool to my tool belt. We tracked everything for 6 months, and exactly everything I did. Heartland is a big, they don't do anything without a ton of research and having their numbers proper. And so we tracked it. Well, it turns out in that 6 months I did my trial, I paid for that laser twice on additional procedures I wasn't doing before.
Wow.
Now, in the first year, I increased the revenue of my practice 38%. So, Jordan, to give you numbers, I'll give you. I got lots of numbers.
Yeah, so I like numbers. Give me all the numbers you got.
38% increase year over year from what I did before. And the only real difference that I made was add a laser. Okay. Now, the second year, we increased it 27% over the previous year.
Sure. Yeah.
And that's when I started taking additional hard soft tissue laser classes, some of the advanced education, adding some of these things. And the great thing about it was it affected every aspect of my dentistry. I went from doing some cosmetics to a whole lot of cosmetics, because when you talked about getting the proper gum heights, everyone can do veneers. Every dentist out there claims to be a cosmetic dentist. And
sure. Yeah.
Now, we could drill on teeth, have a lab build those veneers, slap them on, and they stay. But if you're a famous painter, you're not going to go to Michael's and have your paintings framed. You're going to have nice, customized frames around it. The gums are the customized frame. And so having the proper crown height ratios, proper size teeth, and not be limited by where the bone is, because I can move the bone wherever I want to get the cosmetic procedures. What that did is it added value, not only financial value, but really cosmetic value to my veneers. And then when one had that done, then all her friends ended up joining. And I'm thinking of one lady in particular. She's got a female group of golfers that she's in charge of. She got like 20 golfers that they all golf together. When she got hers done, another friend came in, and another friend. I did veneers on like 19 of them. They started seeing that the one got it done and they loved it.
I would imagine the labs liked working with you too. With the
well, first off, they're like, "What are you doing?"
Yeah. So clean and nice to. Yeah. That's where my mind goes, because I used to manage a lab, right? So I'm like, man, this sounds like a really good thing to put into a practice, because it makes the whole, just a lot of the procedures you're doing a lot easier and cleaner.
Well, and from a lab's point of view, if you're doing more, you start getting priority, right?
Yeah.
And so you start getting the best lab techs, because you start saying, hey, I'm your number one guy. I'm the guy that's doing all these veneers. And then you build those relationships and you get the best product. Those who do the most dentistry get the best product out of it.
Totally.
And again, I have no basis behind that, but it's just so that I ended up getting, Barb or Sharon working on my cosmetic cases every time, and they were in charge of the lab. So shout out to Night Dental out there. They're my people.
They're your people. Sweet. That's awesome. That's awesome. Very cool.
What type of investment would you be looking at, like as a dentist, and you want to bring a laser into the practice?
That's a great question. So a diode, you're going to find that the range is probably going to be the $6,000 to $12,000 range, depending on. There's a new one out that is like $12,000. That's different company. Ours falls right in that middle of that realm. We like to call ourselves the leaders in dentistry. So, I would want to make sure that we're doing the best laser we possibly can at the best value. And you think about it from a marketing standpoint, from BioLase, our premise is get you involved in lasers, just like I was involved in the diode, and then have us grow. So getting more lasers into the hands of dentists is going to help our bottom line, because a lot of these users are going to start going, I want the bigger laser that's more readily available. Now, the next laser, it's a significant step up. And remember, I told you I paid for it twice in the first 6 months. You're looking in that $70,000, $80,000, $90,000 range.
Sure.
That can be paid over time. But I was able to generate $150,000 in the first 6 months and added procedures I wasn't doing before.
Yeah, I would imagine that. Yeah, you now can expand your revenue based off of the new services that you can provide for your patients, which is that's. If you want to know how to win in business, expand your service offerings, and you win more than trying to find new patients all the time, right? So that's pretty cool.
So I was with a sales rep the other day, and he made the comment. He goes, from the procedures you're going to add in this is going to be able to pay off that note. And I said, hold on. No, if we're just doing these procedures to pay off the note for that, you're doing it wrong. You should build value. And there's nothing I do without having a greater value. Why would I put any extra effort into something that's going to keep me in the same spot I was at? So financially, one, I was doing better dentistry. That's great. But the ROI that was associated, if you don't have the ROI, it's hard to do that thing every day. But if you see a value, financial value, you're going to do better dentistry, treat patients better, open your practice for fewer referrals, keeping things in-house. That's where I want you to make money. And it's not about making money. It's because it's a byproduct of doing these procedures.
Oh yeah, that's exactly what I was going to say. Money is a byproduct for offering quality, services in general.
Sure,
right?
It's just hard to offer quality if there's no ROI that's associated. You know?
Absolutely.
And so when the sales rep said, no, you'll be able to pay the monthly note by adding these procedures, I'm like, no. If you're just making the payment, you're doing it.
Yeah, I want to make a profit after the payment.
Think big, you know?
Yeah, absolutely.
It's like this
I mean,
like,
I get what the rep was doing, but
Sure.
in all reality, he probably could have had a little bit bigger vision.
you and I would have sold it completely differently, Jordan.
Right? Yeah, totally. When we sell our software, here at BoomCloud, I'm not saying, you're gonna be able to make your payment to us by breaking even with, all the patients that are signing up for your membership plan, right?
Right.
We're gonna say, no, you're gonna expand this into something that's way more than what you're gonna be paying me.
Right.
So
a major asset out of it. That's how I view this after this discussion, is that having those types of tools are major assets that contribute towards, further making the business extremely successful.
Yeah.
Well, and here's a really cool thing that we do. Depending on where it's located, oftentimes we do what they call a WETP, or water lace experience trial program. There you go.
Yeah. It's a mouthful.
Yeah, acronyms. So it's a WETP, which is an awful acronym. It's wet pee, but that's how I remember it. But what they do is they take 45 days. You go and get the free training. We put one of these lasers in your practice for 45 days, risk-free. If you don't like it, we'll come back, pick it up, take it back. But I find that it takes about 45 days to really start to turn the needle in where you're going, because everybody who does the WTP trial ends up purchasing the unit. So it's a matter of, dentists don't like to change. We love what we've always done. We don't like to change or do anything different. But if you say, hey, we got 45 days, try it for 45 days and see what additional procedures you can do, additional revenue. All my lasers have a name in their practice. We've named them.
Yeah, that's nice. That's cool.
So
what's the coolest name?
Them on social media. We have a new employee. It's Wally. Wally's one of my one of the laser names.
I love it.
This is our new laser to our practice. But when they start realizing, oh my goodness, I can not only pay the monthly payment, but I'm going to increase the revenue, be able to offer different procedures. So if there are dentists out there that want to try this, talk to the local rep. And if there's a WTP trial experience in their local area or anywhere in the U.S., I know we have one in Denver coming up next month. There's one in Fort Lauderdale next month. So they're all over the place. It's a great way to get your feet literally wet for just a bit. Yeah. And see if that's something that's going to benefit your practice.
That's awesome. What website can doctors go to learn more about this stuff?
Biolace.com.
Biolace.
And while you're there, there's an education tab, and we've got a series of recorded webinars that are phenomenal. Cool. From famous people who are using the laser all over the country. And I say famous, dental famous.
We know what you're talking about. Yeah.
So amazing clinicians from all over talking about the different aspects of and they're all pre-recorded. They're all free. In fact, you guys may want to check out one of them. There's one on billing and coding by a lady by the name of Teresa Duncan.
Oh yeah, we know Teresa.
Okay, all right. So
she texted me the other day.
Billing and coding for dentists is got to be the most boring thing you'll ever think of. I can't stand it. I got people that deal with that. Yeah. But Teresa Duncan makes it exciting.
She's fun. Yeah.
She's phenomenal at what she does, and she highlights billing and coding for laser procedures. So go back and see the webinar there. And
I'll check that out.
Great job there.
Yeah, we'll post that. I just posted. I sponsored one of Teresa's articles recently, and
did you?
Yeah.
Nice.
She does great stuff.
She does good stuff. Yeah. She's fantastic. No, that's awesum. So
she's dental famous then too, right?
She's dental famous too. Oh yeah. So no, this is really interesting. I had to talk. You ought to meet my my dad. He owns a dental lab and works with tons of practices. I'm sure there's a way to talk to a lot of his practices, that he works with. In regards to this, do you guys distribute the laser through like any of the big players, like Henry Schein and things like that?
So we do internationally.
Okay.
So internationally, we do, and I believe we have some affiliations with Henry Schein
Sure.
and so forth. But you're going to get the best value going direct to consumer on
Directly.
this one.
Okay.
So go through BioLays, and then you'll have to have the middleman in the middle that's
Sure.
take their cut and do their thing.
So go direct. Okay, good tip.
I would go direct. It's just going to make life easier. You can buy all our tips direct too, save you some more money there, because there's a tip associated with different procedures. It's just how energy is delivered. I don't like to use the word new technology, because this technology has been around a long time. I like to call it advanced technology.
I was just going to use that same word. It sounds like it's advanced technology.
Advanced. But it's all a matter of how laser energy is delivered. And so it's a delivery device that we sell, is how we can get energy from point A to point B.
Yeah.
And we've gotten really, really good at
really cool
focusing that energy. And I'd be intrigued to see what your dad says about any preps or impressions that were taken with a laser versus if you've putting old school packing cord in there and tearing the
well, I have firsthand experience with because I managed the dental lab for about 8 years.
Sure.
So I always hated it when we got impressions with they used cords, right, packing the cord and all that. It was really bad. And then we had a doctor that got a laser, and holy smokes, it was night and day difference. And the restorations that you could build with that just were so much easier, and it had less complications, right? So I'm a fan. I think it sounds really cool.
And I actually, for the lab that I work with, I have one of the lowest remake rates among that lab, because now I'm not saying I'm perfect. I screw up and I do my fair share. But at the same time, they said that my remake rate is less than 1%. Because we use the laser on nearly every crown we do to make sure we get great margins. We digitally
which is so critical.
We digitally scan, which makes it, if I can't see the edge of the prep, we pull the laser out.
And I would imagine if they're scanning versus doing a traditional impression, the scanning with impression, how they can scan them now. I would imagine that's just clean and easy to work with. So I would, in addition to being able to add more services within the practice to your patients, just doing better quality dentistry helps with all the procedures, right? With a laser.
Not have to wait for the remake to come back when it doesn't right.
That sounds like pure chaos.
I'm not a dentist, but I'm sold. I'm going to buy a laser, and then every time I go to a dentist, say, can you use this on me, please?
You're just going to bring bring your own laser? Ben's the guy that brings his own laser.
Well, Dr. Russ,
awesome.
It's such a pleasure chatting with you. This was a fun conversation because it hits home for me personally, because I have a personal experience with it. And now I know what the questions I need to ask when we take our son in.
No, that's awesome.
Just, evaluated further. Of course, for the listeners, we will post, of course, BioLays in the show notes for those of you that want to take a look at it, or at least those that should be, considering looking at a laser. I think this is a great episode for at least a little brief introduction on the various different things that laser treatment or technology can provide. Any closing thoughts, Russ, or anything final that you want to share with our listeners today?
Well, thank you for what you guys do for the dental community. You guys provide a great service to help us be able to navigate these dental waters. But honestly, it's been a lot of fun. I've really enjoyed this, and like I said at the beginning, the reason why I teach the lasers is I want dentists to hit the goals that they want to hit, be able to do the type of dentistry they want to be doing, make more money for what they were doing, what they can bill out for, and just enjoy their life. Because if you can do those things, it's hard. Dentistry's hard. And if you can do those things, it really revitalized me in the later stages of my practice. And of course, I'm really old saying the later stages of my practice. But, when I hit year 15 or 14, when I got this laser, dentistry was easy and it was boring. It was mundane. And then I was able to get this laser and it energized my practice. My patients saw it, staff saw it. And that's why I'm a big proponent of it.
That's awesome.
Very cool.
Well, check it out, folks, biolace.com. Again, Russ, appreciate you and appreciate Haley for getting this set up. So all of our listeners out there, if you like what we do, give us a like, share our podcast episodes.
Or whatever you do these days, yeah.
Yeah. We appreciate y'all for making our show happen. So again, Russ, Jordan, Haley, thank you so much for today. Really appreciate y'all. Best of success as you continue moving forward, and go Utes and go BioLace. Thank you, everybody.
Thank you much.
See ya.